Okay, I think we're going to get started. We still have a couple people coming in, but in the efforts of time, I want to make sure that we use this entire hour to talk about increasing participation. So welcome everybody. We're really excited that you're able to join us today and talk more about how to bring in more participants, more patients, more clientele, wherever you are coming from. Just a quick introduction of myself. My name is Ashley Danielson, and I am the Nutrition Coordination Director with the Nutrition and Aging Resource Center. And if you are not familiar with the Nutrition and Aging Resource Center, we operate as a collaborative partnership between the Iowa Department of Health and Human Services and Iowa State University under a cooperative agreement with the Administration for Community Living. The primary mission of the Resource Center is to support the Older Americans Act senior nutrition programs across the country through high-quality resources and technical assistance. The goal of the Nutrition Aging Resource Center is to support the National Aging Network, former and future Innovations in Nutrition grantees, and other Older Americans Act stakeholder organizations in the development and expansion of nutrition programs in their states and communities. This is done by providing resources to the Aging Nutrition Network on our website, acl.gov/senior-nutrition. These resources are to help state units on aging, area agencies on aging, and local service providers to develop impactful, cost-effective, and person-centered services that align with the purposes of the OAA Title IIIC. So just a little bit of information about what we're doing today in the next hour. I am going to provide some background on the Iowa Cafe and our three panelists. And then really this time is meant for our panelist discussion where I'll be moderating, asking them some questions, and they can be providing more answers and resources. And then hoping that we have enough time for a Q&A at the end with some additional resources on increasing participation. Couple of housekeeping items. Closed captioning is available by turning on the closed captioning icon at the bottom horizontal bar. During our Q&A session at the end, you can add your questions into the Q&A box, or you can add questions or additional conversation into the chat box. Okay, so we're going to start off with a really quick poll here just to get a little bit of interaction. So I am going to launch, let's see here, this first poll question. And if you can put your answer in, that'd be great. It's kind of nice to just see where everyone is at right now when we're talking about increasing participation. Just give it about 20 more seconds here. I'm going to end the poll and then share the results. So you can see, it looks like kind of a 50-50 with people struggling to get more participants, clientele or members. And then sometimes it can vary, right? So maybe it just depends on the season, the hours, whatever else is going on in that area. So thank you for sharing your answers with us. Okay, on to the next slide here. We'll move on with introductions of our panelists. The first one is Beth Sadowasser. She is the owner of Sodes in Gothenburg, Iowa. And the full name is Sodes Greenacre Country Market and Cafe. They have been in business since May of 2016. And in 2022, they added a coffee shop, Perk Central, and expanded the gift shop to put more emphasis on Iowa and locally made products to their business. Beth's sister-in-law, Linda, has been the main cook since they opened, and another employee, Crystal, joined them in 2017. Linda and Crystal are instrumental in the operation of the cafe. Another panelist we have today is Janet Bowles, and she is the Director of Nutrition Services with the Northeast Iowa Area Agency on Aging. Janet's innovative program, Making Meals Easy, won a national award from US Aging. She has been a national presenter on multiple healthy aging topics. Janet has 26 years of experience in the aging field and 32 years in the fitness industry. Janet has a Bachelor of Arts in Family Services from the University of Northern Iowa. And then lastly, we have Bambi Press. She is the Healthy Aging Director at the Iowa Department of Health and Human Services with the Division of Aging and Disability Services, and also with the Nutrition Aging Resource Center. Bambi supports the Aging Network in the delivery of Older Americans Act congregate and home delivered nutrition services, including new innovative service delivery models that are changing the senior nutrition program landscape. She previously served as a community nutrition director for a home delivered meal program in central Iowa. And Bambi is a registered licensed dietitian who is committed to helping people enjoy better quality of life through improved access to good nutrition. So welcome, Beth. Welcome, Janet. Welcome, Bambi. Thank you so much for joining us today. Before I stop sharing my screen, I want to give you all a quick introduction of the Iowa Cafe, and I know Bambi will expand upon this. But the goal of the Iowa Cafe project is to modernize Iowa's congregate meal program, delivery mechanisms, and outreach to increase the number of consumers and meals served. The project objectives include establishing a restaurant partnership infrastructure, developing flexible approaches to reach 2 generations of older adults, modernizing processes with technology, and providing nutrition education to rural older adults at risk for food insecurity and social isolation. I'm going to stop sharing my screen, and you'll see that Bambi and Janet and Beth are all on video, and we're just going to walk through some questions that we have. Again, this is really going to be the bulk of today's event, and then hoping we can have some time for Q&A at the end. So, and I've also told all three that although I have specific questions for them, if any of them want to hop in and expand on that answer, to please do so. We're very flexible here, and we just want to give you as much information as we can. Okay, so let's start off. Bambi, I'm going to start off with you. Tell us how the idea was created for the Iowa Cafe to start partnering with other restaurants to provide meals to older adults.
Sure, I'd love to. And I'll actually start by saying that while I wish I could take credit for the idea, I definitely can't. This work started before I joined the State Unit on Aging. So I actually came on board after it was created and the project had already launched. So my role now is really, to make sure that we don't break it. And Janet may have some more insight into that. But, I also want to mention, and I think there'll be an opportunity to talk about this more, but some of the really forward-thinking things that my predecessor, who is Alexander Bauman, who is now the director of the Nutrition Aging Resource Center, that she, really did, that kind of laid the groundwork for this project. As we know, and probably the reason why many of you are on this call today, congregate nutrition services are really kind of at this inflection point. Right. It started before the pandemic, and the pandemic really, accelerated it and amplified what we were seeing it. So like other programs across the nation, and, really even worse, Iowa had seen about a 60% decline in congregate nutrition participation over the course of about 9 years. And so around that same time, the State Unit on Aging started with a study of our congregate nutrition program to figure out what were the barriers, what was getting in the way of people participating. And so there were a number of things that were identified in that work that really, again, kind of laid the groundwork for this project. So things like the nutrition guidelines themselves, what could we do to make sure that, they weren't any more strict than they really needed to be. Things like, the menu and, where we could interject some choice and flexibility to make services more appealing and really kind of meet people where they are in terms of nutrition services. The environment, right, and the setting. Having a meal in a church basement at 11:15 on a weekday just doesn't work for everyone. So, we recognized that there were a lot of people, that we were missing, really. And then, funding, always a concern, and we can get to that, I'm sure, in today's conversation too. But even like the intake process, and, some of those kind of, unfriendly processes, looking at how we could, again, kind of make those a little bit easier for people to go through. And then the marketing itself. So, we really found a lot of potential participants didn't really know who the Area Agency on Aging, the AAA, was. And then in some cases, if they did, there was some stigma around the nutrition services themselves and, who those services are really designed for. So this was a nice way to make it clear, that those services really are for anyone, 60 and over who is eligible for these programs. So, really kind of took that information. The State Unit on Aging and Iowa's Area Agencies on Aging got together and brainstormed some ideas to address all of those barriers that I just talked about. And then, that's where the idea to partner with restaurants was really born. We had some AAAs that were already partnering with restaurants in kind of a smaller way. So, it was kind of an expansion of that. And, across the nation, we saw some other projects starting to take a similar approach. So the state contracted with one AAA in Iowa initially. We have 6, and their nutrition director, who was also a dietitian, and the AAA leadership and staff. And, they were a major driving force, like Janet, a major driving force behind the project. And so then the AAAs leveraged some grant and pandemic relief funding to then implement the idea across the state.
Definitely probably not as easy as you think it would. It doesn't happen with a snap of your fingers. So
no, there was a lot of kind of pre-work really that went into it.
Sure. Okay. Thank you, BNB. Janet, what was your first step in initiating a relationship with the restaurant Sodes and other partners as well? Would you do anything differently with those first planning steps?
So I did not. I know a couple of the other agencies in Iowa had a little difficulty kind of getting into and talking to restaurants to get their interest or whatever. We were already partnering with a couple of restaurants during the pandemic. So we had some stuff going already. So we were able to approach them and they were like, absolutely, absolutely love this. We can make this work. So when I was going into, say, a new community like Sodes, Guttenberg, it's a pretty small community. And I just thought of it this yesterday afternoon while I was kind of prepping for this. So I got the recommendation from my hairstylist because she has a cabin on the river in Guttenberg. And she said, oh, you need to go to Sodes for this deal. You need to check out Sodes. And she wrote down Sodes and the phone number and she gave me 2. So it's just kind of funny where you'll get a reference for a new restaurant or a cafe partnership. But if I didn't have anything to begin with, I always spent just a little bit of time connecting with the local Chamber of Commerce and Economic Development, maybe even stopping in City Hall and driving through the community. We're pretty rural in many of our communities, and it just makes a little more sense to actually kind of go and visit and see where folks are already going. I always asked about how many hours are they open during a week, and does it seem to be an appropriate location for someone who may use a walker or who is an older person and would struggle a bit with some accessibility issues. I've had lots of requests to consider putting an Iowa cafe into a community in this one restaurant that everybody does adore, but we're in Iowa. If you didn't get that already, 4 or 5 months a year, we could have snow. And this particular restaurant, the only bathroom is outside. So I just keep kind of putting that off because I just don't think that that's very appropriate for some of our participants and our consumers. But I looked at those kind of issues to see if it made sense. I also really would check out the most recent health inspection because we can do that online. And that sometimes gave me a little indication too of, restaurants, are they actively concerned about health and food safety? I mean, just because people really love to eat there doesn't necessarily mean that health inspection is good every time. So we would do a health inspection review just to see what was going on. And then social media. most of our locations are now using something, either it's Facebook or Twitter. A lot of our folks do have Facebook pages. Some of them have websites, and I would go there and take a look at that information as well, looking for comments from people. Sometimes there's reviews. I don't really get crazy about the reviews because there's almost always one person who makes a lot of noise, and that may or may not be a good review. But looking at their menu was really helpful for me, because then I could kind of have an idea. Did what they were serving, did that make sense already for us? Because I really hesitated to go into a restaurant and say, hey, we'd like to partner with you. And oh, by the way, we want to change absolutely everything that you're doing. That just was, a non-starter right there. So we would look at what they were already providing, the hours they were serving, the meals that they had, the sides. And if that made sense, then I would try to make a phone call, a connection with that restaurant, always paying attention to what their busy hours were. So if you could call, between 10 and 11, that was best, or after 2 in the afternoon, that was good too. And then make a personal visit with some information. So that was our initial contact, and I had a lot of good results. I did, there was a couple of restaurants that just absolutely didn't want to connect with us on this, and it ultimately turned out to be okay. The reasons for that was staffing problems, and that's probably where the restaurants have had, from my perspective, the most concerns about doing it is the fear that this program would bring in enough new individuals and consumers or participants or customers that their staff would be kind of overwhelmed, and it would just really impact their ability to provide the meals like they have in the past, and they want to in the future. So that seemed really it worked well for us. I don't know whether connecting with smaller focus groups in some of these communities might be a good idea. We didn't need to. We got a lot of information, as I said, by just asking some of the folks in town, hey, what would you suggest? And because we cover 18 counties and we have board members, we have advisory council members, often I would give them an opportunity to, hey, what do you think about a restaurant in this town? You live in this county, tell me what you think about it. And that was another really good resource for me to get that personal information from someone who uses it already.
Thank you. Beth, you're up next. Tell us about your initial reaction when Northeast Iowa Area Agency on Aging reached out to you to become a partner restaurant. Oh, you're on mute.
My first thought was, what is this? I had no idea. And then I was like, who are you? Anyway, so I met with Janet, and it was a wonderful meeting, and she explained everything really well. And so once I knew who you were and what you were doing, I thought it was a great idea. But then there was the hesitation of, can we do it? And for us, it wasn't so much, will we have the staff to take care of the increase in business that we anticipated. It was really, can we afford this? Because you have to marry up the nutritional needs with what you're already offering, and the cost constraints and all of that. So that was probably my biggest concern when we first decided to go with this.
Okay, perfect. Janet, tell us how you were able to market the opportunity to older adults and to partners across the state of Iowa, or at least within the Northeast part of Iowa.
Well, our very first restaurant, which was Not Sods, we want to get this going. Let's see what we can do. And we actually purchased a mailing list. I think it was either a zip code, or we did a radius of 20 miles or something. And I think we sent out 4,000 letters to older individuals within a whatever. Absolutely stunned that there were that many people that lived that close to that little rural, teeny tiny out in the country restaurant. And we had a huge response very quickly. So I wouldn't say that was a mistake, but we have not done that since then, because it was just a lot of people very interested, and they wanted to participate right away in the program. And we have not really talked about this at all. And I don't know if this is maybe one of the things that we need to chat a little bit about was, so the consumers, the individuals call our agency, or they can fill an intake, a registration enrollment form, we call it. That seems to be more palatable for some of our folks online. And then we connect with them and mail them a little card that is used as the way to track the meals. And that's one of the things that is just so important for the way we operate, because expecting a restaurant to track individual consumers, well, who are they and where do they live and how do we do, that was just too much. You know, the restaurants have to turn over business, and how do you track that? So these cards were really good. We use a program called Senior Dine, and it makes it very easy for us to track the consumers. The restaurants can see how many meals they've served on any given day. They can get a really nice report at the end of the month as well. We can pick and choose what the price is for the meals that are in each one of those restaurants. And that has made it incredibly more or less difficult to get this whole system set up. So, you know, marketing it to our consumers was not hard. Word of mouth was amazing, especially again in these smaller communities. I remember my first visit as a site visit to Sodes. I want to say it was in July, maybe, or it was in the summertime after you'd been open for a couple of months. And I visited with some of the folks that were eating on, in our program. And a couple of them said, you really, really we need to get this out. More and more and more people. I've been telling everybody about it. So word of mouth in the smaller communities doesn't take very long for us, to get around. That we continue to use table tents, and I believe we've done presentations on it as well. So we haven't had a lot of trouble once we've started to advertise that the program is out there.
I can maybe add
BMB.
to that
Oh,
a
go
little
ahead.
bit. Yeah. So Janet mentioned, the Senior Dine technology. I think one of the really important steps that we took at the state level was to develop a couple of really replication toolkits. And I think maybe we'll talk about that some more in just a little bit. But one of those was really designed for the restaurant partners, right? Like Beth, to provide a little bit of background on what Older Americans Act nutrition programs really are, and, the purpose of those programs, how easy it is or can be to meet the nutrition guidelines using, items that are already on your menu, maybe with just a little tweak, here or there. And then the other replication toolkit was designed for the area agencies on aging. So it included a lot of that information around the technology piece and how AAAs could, kind of manage that volume and, roster the meal, like all of those things that were imperative, like Janet said, to making these partnerships work. And then there was a marketing toolkit included in that, in those replication guides as well, with letters, both to consumers, to restaurants, to public officials, all of that they could use, press releases, all of that they could use in, really kind of marketing the program. And then from a marketing perspective at the state level, we also worked to secure support from the governor's office. We're part of a governor's Feeding Iowans task force. And so we were able to secure, that support and develop some partnerships with economic development and, chambers of commerce across the state to really, like I said, start to build those partnerships. And, that part has really been key, in marketing this project. All of those, hunger fighting organizations and all of those groups that we're interacting with, really all of those stakeholders across the state. We worked hard to make sure that they were aware of the program so that, they could all be involved in that marketing and in that word of mouth. So that part was huge. Lots of newspaper articles and, a little bit of, press on the news, things like that really helped word spread quickly.
Great, and that was one of my questions for you, to talk about the resources, specifically the Iowa Cafe Toolkit. When we share the resources later that we have on our website, I'll link to that and give you like a little snapshot of what that looks like. But Bambi, I still have another question to add on to that. Can you talk about the different roles that were contributed within the project, and then how each role contributed to participation?
Sure. So as I mentioned, we have 6 area agencies on aging across the state of Iowa. And so, while the state unit on aging kind of took the lead in drafting, the grant application and organizing the project and kind of laying the groundwork, like I talked about, like making sure that our state nutrition guidelines really leverage the full flexibility of the Older Americans Act. The state, like I said, developed those replication toolkits. That was, a really key part of, the original vision and work plan for this, for this project. And those are really a difference maker, I think. And maybe Janet can speak to this as well, because, the last thing we wanted was for, everyone to feel like they had to go out and reinvent the wheel. As the work that we do with the Resource Center kind of takes that same approach. Like, you don't have to start from zero. And so all of these materials can be adapted to, your own needs, but we wanted to, provide some kind of a starting point, an example that would make it a little bit easier to, like I said, establish these partnerships and, be able to demonstrate to someone like Beth how easy it could be to, to partner with that local area agency on aging. So that's where the 2 different guides come in. And, I'm happy to kind of go through, what's in those guides, everything from the nutrition guidelines and sample menus, that marketing toolkit I talked about, cost proposal and contract drafts, those letters that I mentioned, surveys, the technology resources that I mentioned, really making sure that we included all of those things in the toolkit was really important. But when we talk about roles, I would say that those, the AAA nutrition directors are really the face of this project. And like Janet, they're the ones who were, really identifying the target counties. They used focus groups early on to develop even the branding around, the Iowa Cafe itself, and, what it was going to kind of look and feel like. Really involved in developing those marketing materials and working with local media and chambers of commerce to get the word out, identifying those local partnership opportunities like Janet talked about, and sometimes it was a recommendation from, their board or advisory council, or, like you said, you're a hairstylist, with all of these great suggestions. The AAA nutrition directors were the ones helping to develop those menus. And certainly we, have supported those efforts at the state level. I'm a dietitian. I can help to kind of look at a menu and make some suggestions. Here's a list of things that I think might work. Here's some things we might want to consider. And then the AAAs have their own contracted dietitians who support that work. As well. So, ultimately, our area agencies on aging, just as part of the grant project, the Innovations in Nutrition Grant Project, contracted with 22 different restaurants. And even more than that, over 50 across the entire state. So, we really, I don't want to leave that part out as we're talking about roles too, because it was those restaurant partnerships and people like Beth who are willing to sign on and give it a try that have really been critical.
Thanks. I think that's helpful for our attendees on the call to understand, how all of those pieces come into play. And Bambi, tell us a little bit, well, I'm going to ask Bambi and Janet and Beth a little bit more about numbers, but when you talk about increasing participation and targeting specific populations and who, with those trends and tracking who is coming, who started showing up that maybe wasn't coming before to those meal sites or those restaurants?
Sure. So I'll kind of circle back to that study that was done that identified, the barriers to participation that we were seeing that were contributing to that decline that we saw across the state. And so you'll see, if you start to dive into some of the replication materials for this project, you'll see a lot of focus on reaching two different generations of older adults. And so, we really have seen that, those people who are attracted to that kind of traditional model for providing meals, at a senior center or, one of those more traditional locations, those folks go to that center for a reason, right? They like it there, their friends are there, they like the activities. But we found that this model really attracts a different type of consumer. So, those people in that 60 to 75 age range who were not really well represented in our congregate nutrition program, prior to these partnerships. A lot of those people are, they're still working, right? Or they have other demands on their time. They're caregivers. Lots of reasons why they may not be able to participate in some of those traditional services. So we also found that these younger adults were, and across the board, were more likely to be experiencing food insecurity when we really started digging into the numbers. So we developed some data visualization dashboards at the state level as part of the evaluation of this project to really get a sense of, who these partnerships, were reaching. And we've seen that, some of the restaurant partnerships that the AAAs have launched have reached, exactly the right targeted populations, that they needed to reach in their communities. And in some cases, candidly, they haven't. So it's great to have that data to be able to, really evaluate those partnerships, even down to the provider level, to see, who's taking advantage of, meals at which locations. But overall, we found that people taking advantage of the Iowa Cafe model, like I said, are more likely to be at risk of food insecurity. They're at higher nutrition risk, according to the screenings that we use for Older Americans Act nutrition programs. They're overwhelmingly more diverse. And so it really, opened the door for people who either weren't able or weren't willing, to access those services at, some of those traditional sites. We saw that just within the grant project, those 22 restaurant partners that I talked about a moment ago served a little over 98,000 meals over the course of the grant to, over 6,000 consumers. And that's in just one small part of the state that we used for that specific evaluation. But we saw that it increased participation in congregate nutrition services by 112%. So, more than doubled overall. Increased reach among older adults in that 60 to 74 age range by 344%. Among older adults who identify as Hispanic by 123%. Reach among other culturally and racially diverse groups by 125%. Among consumers living with food insecurity by up to 38%. And increased reach among those in rural areas by 112% when we went back and looked at what I would call the last normal year, so our 2019 data. And so we really saw that it's been a really effective approach in reaching, candidly, almost every group that we worked to target with the project.
Amazing. Janet, we've talked about increasing participation and how you did that. So we'll kind of skip over that piece, but talk to us about how many older adults showed up the first day to SODS. And then also you've touched a little bit about the population in that area, but if you can expand a little bit about how many older adults there really were and really what the expectations were. Were you surprised compared to other locations or other restaurants?
So as I looked back and this is the benefit, the glory of the senior dining program. It really worked. I could go back and find the day and how many meals were served on that day. And that was in May of 2022. And there were 3. So the first day, not a ton, but 155 meals were served in that month. And then I checked in June and it went up to 290. So almost doubled by the second month. And there are only about 30% of the population, 1,800 people or so in Guttenberg. So that's quite a few people. we had another restaurant that served 500 meals their very first month that they were open. And I want to say it was probably the same time as Sodes, around May. The unique feature of that restaurant is that at the time, they have since expanded, but at the time they were newly licensed and they were only open Monday, Tuesday, Wednesday, Thursday from 4:30 to 8 in the evening. And they only offered like 3 items each night, always burger and cheeseburger with sides, and then another special. But it didn't seem to matter. That was enough flexibility when it came to choice. It gave the folks an option. Clearly, those 500 meals were happily received in that town. And it was maybe 20, I don't know. Beth, is Epworth 25, 30 miles from Guttenberg? Not very far. And so she's, yeah,
No,
25,
you're
30
unmuted
miles,
still,
not
but
very
yeah.
far away,
Yeah.
not very far away.
Yeah, it's about 35, 40 miles
Yeah.
away.
Okay, so, we're seeing a lot of consumers that in these small towns, they want to go to these restaurants. They want to be there and see their friends. So the community is pretty small. There are folks, Guttenberg is kind of a touristy place. It's on the river. It's lovely. Tourism is a big piece of their local economy. And we do have people who go into that restaurant and they'll call us later and say, what is this Iowa Cafe thing? They'll see something and they'll want to know a little bit about that. We use table tents on the tables or flyers that are stuck in those little salt and pepper table things, to help share information about nutrition education, about how to register for our program, and always, the contributions, because we don't want the restaurants to have to worry about that contribution. So what we do is then provide a letter at the end of the month that, gives a record of how many meals they ate and what the value of those meals are, and then encouraging them to consider making a contribution back into the nutrition program afterwards. Did that answer your question?
Yes. Yes.
Okay.
Thank you. Beth, did you do anything additional to bring in more clientele at Sodes? And if so, what did you do? And then a couple more questions to go off of that so I can repeat these. But was there a favorite or least favorite item on the menu? And did you offer a consistent menu every day? Did it change? And if so, did that change the amount of participants that visited your restaurant?
Sure. So we did quite a bit extra to get people to come in and learn about the Iowa Cafe. Of course, we had all the table tents that Janet talked about. We had the newspaper come in and do an article and put that in the paper. We put it on the radio. But I think probably the most effective thing was that we personalized it and we told them about it when they came into the restaurant. And in these small communities, I'm the owner and I know a lot of people, so I had a personal connection. But, waitresses oftentimes will have a personal connection with their customers. And so they're ideal to sit down and tell them all about this program. And then with the older folks who maybe struggle trying to sign up on the internet, I actually just took my laptop in and sat down with them and signed them up there. Now, some of the questions were a little personal, so you had to have a connection to do that. They're not going to do that with a total stranger, but because you know them, you know your people, we were able to do that. And so that helped increase participation. One thing I kind of picked up on early on when we were doing this was that people associated this with, this is a charity, this is only for poor people, and I can afford my own meals. And so I took a different angle with it. And I said, what I really would like to see is everybody who's over 60 participate in this, because the person who is a little less fortunate and needs it doesn't feel like I'm getting charity here. When they see you eating, they're going, well, look here, everybody's doing this. And then I said, you can just pay that back by just, when they send you that letter, pay for your meal. So you are paying for your own meal, but at the same time, you're also incentivizing people who are less fortunate to come out and eat. And I think that was well received. So I do see a lot of people that are at different socioeconomic class coming in and eating. And I'm hoping, Janet, that they're paying for their meals, because that was how I presented it to them. And I think that helped. One thing I noticed about Epworth, and when you talk about it night, there's a big difference night versus day. I've been in the restaurant business, and I can tell you, nighttime is always bigger. It just is. So if you can be open at night, you're gonna serve more meals. People want to eat at night, and for us, it just didn't work. Crystal and Linda like to work the breakfast and the lunch, and so that's what we've kept with. Um, so that's kind of what we did to try to increase the participation, and then we kind of slowed down, and I think I got the information from Janet, maybe hold up a little bit. We're trying to have a hard time keeping up, but we can certainly go back and try to at this point in time increase participation again. So that's what we did, and we continue to have the information out. We have a little, like in our coffee shop, a little area where they can sit and they can read the pamphlets that Janet sends out. We keep it at the checkout. So what was the other part? What were the other parts of your question?
Well, just talking about items on the menu. Was there something that was really popular, and did you offer consistent menu, or did it change?
Okay. Well, when had to make a decision on building the menu, and maybe I'm going to jump out of turn because I think this might have been the process of creating the menu. I guess I'll leave that for later. But what I do it right now. So, well, for your restaurant,
you can share it all right now. That's fine.
Sure. So if you're not a restaurant owner, there's things you have to think about through their eyes. So when Janet presented this to me, I said, well, basically there's three different people looking at this process. There's the Iowa agency with their nutritional guidelines that we have to meet. There's the customer who wants variety and nutritious, and it's got to be appealing to them. And then there's us, the restaurant, and we have to produce a menu that we can afford, but we can also manage in the back of the house where we don't have all these different ingredients for all these different things. So everything kind of had to work together. And so in creating that menu, meeting the nutritional guidelines was really good to work with. The nutritional the people, the nutritionalists. I had a little background with some nutrition anyway, so it was a little bit easier maybe for me, but I understood what we needed to do. And so we created a menu that has a lot of options with very few ingredients. And it's been well received. We've been doing now, I think, a couple of years. I've lost track of time. Probably need to mix things up a little bit. We have not yet. So our menu has remained the same since we started, but we could certainly add some things. But one thing I will say that I didn't want to do is I really wanted to be nutritious, because I know from my work, we don't eat well. I mean, we don't eat enough fresh. We don't eat enough things that are nutritious. Too much fried food, too much processed stuff. So our menu is really quite nutritious, I think. So.
And I love that, Beth. What I did was, when I looked at the restaurant, was I looked at what their menu is already serving, and didn't ask them to recreate to anything big and new. I will say that, and not Beth so much, but some of our restaurants had a real struggle with portion sizes. And that was a huge, one of our restaurants, they're famous for their pulled pork, but they serve 8 ounces of pulled pork that's their sandwich. And I said, that is just way too much protein for us. So, you have to kind of pull that back in, and you don't need a bun that's 4 inches around. Let's take a look at, well, I don't know how big that bun is. Well, get your label out and let's take a look at what that bun size is. So it was, getting the portion distortion that is famous for many restaurants. It was an issue here in some of ours as well. But the menu always kind of looked at what they had. And I am not a dietitian either, but using the menu guide, the menu planning guide, really allowed me to kind of look at what they were doing and put together some suggestions and ideas. They always had full, veto power, because again, as Beth mentioned, she knows what her costs are. And she knows what she can and cannot do. So while I thought, hey, this is a great option, she'd say, I can't do it, because we contracted at a single price for all of the meals that were offered at that restaurant. We say have an entree, it's a sandwich or it's meatballs or whatever. Then you would have sides, and you must pick 2 of these sides. It comes with your choice of coleslaw or pea salad or lettuce salad or vegetable of the day. And then that also included the option of milk if you would like it. And then whatever. It was actually very easy to do. And that was, we could not have done that without changing from the computerized nutritional analysis that was required of our state prior to probably 2018 or 17. I can't remember when they really went to that. But that was the only thing that really allowed us to walk into a restaurant and say, hey, we think we can partner with you to make this very much an economic development for your community. We can start providing, and when you look at some of these teeny tiny communities that we've got these restaurants in, it's amazing. It's one way for us to serve our consumer, older persons in their local communities that we could not do before. I've got one restaurant that the premise costs for me are $6,000 a year, and we're serving about 8 meals a week. And I don't have that with the restaurants. I don't have to pay for all those premise costs, and that makes a huge difference. That's kind of included in our meal with our meal price. So it's just such a win-win for our agency, the consumers that we serve, and we hope for partners like Beth.
Yeah, it has
perfect.
really benefited the restaurant. I will say it has. And it makes more sense to let me pay the electric bill,
You're already doing it, right? For everybody
Right,
else
Yeah.
that
already
walks
doing
into your
it,
restaurant.
and it opens the doors to customers that may not otherwise have come in.
Yeah.
And then we see our Iowa Cafe customers, but they don't always use their card. It's one of the first questions we ask: are you using your card today? Because they don't always use their card. Maybe today they want the special that wouldn't meet the nutritional guidelines, and or they want the hamburger and fries that it just will not put on the menu on the cafe menu. We have it on the other menu, but so it's been a win-win all the way around. I think it's really a wise way to go versus a meal site.
Great. Thanks for expanding on that, Janet. Okay, so the last question is a question for everybody. So we'll start with Bambi and then go to Janet and Beth. What is something that you found to be successful in this relationship that helped to increase participation? And is there anything that you would do differently?
Yeah, so I think some of it has kind of already come up. Like I said, we found some of these partnerships have just been extraordinarily successful, right? Like Beth described, just really kind of you're so vested in your community and making sure that people, knew this was available. We heard a lot of stories of people who, maybe had been going to a restaurant for years and, all of a sudden had stopped coming, or maybe a couple had been going to a restaurant together and, at some point along the way, they started coming less and less and sharing a meal. And, so this was a way to make sure that, in some cases, people could just continue to take advantage of, some of the meals that had already been available to them, even if they experienced some major life changes that sometimes made those a little bit harder to access. And, I love, what Beth said about, sitting down and helping people with the actual, enrollment process. I think we saw that, working really well. Like I mentioned, there was an online registration form that, that people could access. And I think sometimes there was kind of this, perception of anonymity that sometimes made it a little bit easier for people to answer those questions in an online form, and sometimes disclose some things about their situation that people might be a little bit more reluctant, especially Iowans might be a little bit more reluctant to disclose in, an in-person or even a phone conversation with someone, when that trust hasn't quite been established yet. So really, again, it was, some of those partnerships have just proven to be so great. A couple of things I think that we would consider maybe doing differently, kind of along those same lines. We heard we're not the only state, with projects like this. So, we heard some cases of, within the restaurant contract itself, the AAA and the restaurant would designate like a AAA liaison who was, a staff member at the restaurant, but able to really kind of make those connections to services to support healthy aging in cases where it was needed. Because I think something that really kind of to be aware of, and maybe Janet can speak to this, is that, you do kind of run the risk of losing a touch point, right, with the consumer. And so making sure that you're, really working to maintain those connections with your consumer, making sure they understand who their area agency on aging is and, what they can offer to an individual. It's really important to find ways to, to maintain that regardless of where people are accessing services. I think, we mentioned something about the contributions, and I think I saw some mention of this in the chat. That's something else that I think we've learned a little bit more about how to navigate since we've started. We've heard from some projects that have actually worked to include a tip for the server in the contracted rate for the meal. And so then it makes it much more clear to the consumer, if you'd like to contribute anything toward the cost of this meal, just make sure all of that goes back to the AAA, because I think we did see some confusion around tipping and contributions, and created some materials around that. So I think there could certainly be some clarity around some of those things. And then like the nutrition education piece too, Janet's done a lot of great work around that. But as we talk about, like maintaining those connections, working to integrate that piece a little bit earlier. There's a lot of really great technology that programs can access, like evidence-based programs, like Text to Live Healthy or Text to Be Healthy, things like that, that, maybe could be integrated into a project like this a little bit earlier on, so that you're not trying to go back and figure that out after the fact. Sorry, that was 3 things I would do.
Janet, go ahead.
Who's going? Beth, are you going to go?
No,
Janet, if you want to go, and then we'll have Beth go.
Okay. So I feel like local support, and we kind of talked about that a little bit. Beth was very invested in making this program work, and was so involved in helping the consumers understand how it worked. And yeah, we got here, let me get the tablet and we'll just do this registration right here. That local investment, when you're looking at the restaurant you don't need to sell this. You should not sell them. One visit, a couple of phone calls, and they should really be interested in it, and they want to do it. Because if you have to sell the program to them, you're not going to get that partnership that you really do need in order to make it work. It just won't work that way. We had a couple that, I kind of tried, I really wanted it. We talked them into being our partner, and that was a mistake. If you're having a hard time getting them to return your calls, if you're having a hard time to get them to really be responsive to your questions or what you need, that's a bad sign. And you should just maybe kind of walk away from that particular one. So I just think that local understanding of what's happening, who it benefits, why we're trying to do this in your little community. And I will say, we do it primarily in little communities. We do have a couple of in our larger area. They are more culturally diverse in Waterloo, which is our biggest community that we serve. And so we're using this as an opportunity to meet the rural underserved areas of our 18 counties. So in counties that we don't really have any other congregate site, this is our option. This is what we're using. And I think there was a comment about social isolation and how that ties in. And I just want to mention this real quickly. The restaurant people learn the consumers. They learn who they are. So I visited with a lady, and she comes every Wednesday night. She is not one of the SODS participants, but she says, "Oh, Nick knows what I want." The menu item was a grilled pork tenderloin on a bun with a lettuce salad, and she would always have fruit to go along with it. And they brought it out to her, and he had a huge bed of lettuce, and he'd cut up the tenderloin and put it on her salad and added cheese to it and had toast alongside of it and crackers instead of the bun. And she still got her little cup of fruit alongside it. She says, he knows that this is what I was going to do anyway. So they do visit with the restaurant owners. Lots of phone calls from people saying, oh, I always go with my sister-in-law. We go twice a month. Every other Tuesday we go for lunch. I drive one time, she drives the next time. That's the sort of thing that we wanted to see come out of this, that social isolation, that's such a problem in our smaller communities. This gives them a place to go. And even if one of them couldn't really afford to go out, now they both can afford to go out. So that's my 2 cents
Yeah.
worth there.
Mhm.
Perfect. Beth, we'll finish with you and then we'll share some resources.
Well, I'll just kind of dovetail off of something that Janet was talking about, was the social isolation, especially, I see it especially in single older men. They really don't go out. But with this program, we were seeing some single men come in, and of course we're interacting with them, we're socializing, we're becoming their friend as the staff, but they're becoming friends with each other. And so even though they may still sit at their own table, they're talking to each other. And we see this, and that'll really warm your heart when you see, a 70-year-old man who's recently widowed and is now coming out, and he's socializing. He may not go to your meal site, but he'll come out to the restaurant to eat, and then and friendships have been made, and it's nice to see. So
I love that. Yeah, thank you for sharing. Thank you to Bambi, Janet, and Beth. This has been great to give us resources and answer some questions. I am going to hop back to some of the resources that we have as a Nutrition Aging Resource Center. So just give me a second here, and I think you all should be able to see this. We're going to do one more poll question, and then I'll share some resources, and we'll have some time for Q&A if you're able to stay on. So here is one more question for you. If you are familiar with the Nutrition Aging Resource Center, go ahead and put your answer in there for me. Give it just about 10 more seconds here. I'm going to go ahead and end the poll. Again, about 50-50. So a lot of you have heard of us, and some of you have a little bit, and some of you are just hearing about us today. So that's really exciting. I'm going to share some resources with you. I know we're really close to the 11 o'clock a.m. Central Time hour, but if you're able to stay with us, we would love that. We'll just go a couple minutes past 11. So with the Nutrition Aging Resource Center, we are on the majority of all social media channels. So please follow and engage with us at Aging Nutrition, or you can also scan the QR code. You can also subscribe to our newsletter to make sure that you never miss a new resource or connection opportunity. I am putting our website in the chat for you, and I'll also put some links in there as we continue on. So on our website, we have 12 main buckets that allow you to browse all of the resources that we have. A really big one that I want to point out is the congregate and the home delivered meals section. And I'll put the link in here in just a second here, as I'm trying to kind of juggle a couple of different things. So I'll put it in the chat for you. And with our congregate and home delivered meals area, both have a creativity and innovation section that you can get a ton of resources from that would support the goal of increasing participation. Some examples would be how to increase participation by offering a choice menu guide, or how to optimize the meal site environments with improvements that you can make. Another opportunity would be looking at the business management bucket. There is an entire page devoted to partnerships, which allow you to kind of look at different specific businesses, including restaurants, and just kind of figure out what type of partnership you need to create. Of course, we have our information on our innovation in nutrition programs and services grantees. So this is really where we are talking about our Iowa Cafe and where that came from. So if you are looking to innovate more, we have that link in here, and I will just add it into the chat for you as well. With that area, we include a lot of information if you're looking to innovate, but we also have our previous grantees and our capstone projects from those grantees. So that includes not only information about the grantee, but their full report and tools to use in hopes of replication. Specifically, we have the Iowa Cafe's resources available, which includes a guide for area agencies on aging and a guide for partners. So Bambi did refer to that as she was speaking earlier. Please utilize our website for more ideas and resources to support an increase in participation wherever you are. I also want to share the link for the Northeast Iowa Area Agency on Aging website that talks more about the Iowa Cafe participating locations and examples of their menus. So I saw some questions in the chat box asking for menus, and you can see those on there, and SODS is included on there as well. Oops. Skipped a slide there. Lastly, ICANN, or Instructional Campus on Aging Nutrition, has been really one of our most exciting projects that we have launched within the last year at the Nutrition Aging Resource Center. ICANN is a series of free interactive online training modules that allow you to study at your own pace and that cover a wide array of topics relevant to the Older Americans Act nutrition programs. So we talk about partnerships in there, we talk about innovation, but also basics of meal planning, business management, diversifying funding, and more. And the targeted audience for those who interact with older adults living in the community, specifically AAAs, local service providers, even registered dietitians, can also scan the QR code to get there and to register. Okay, so I know we're a couple minutes over, but I am going to pull some questions from the Q&A if you can stay. And so if you have some more, type them in the Q&A box or the chat box. And then I will say, if you do have to hop off, and when we do end it, that we do have a short survey afterwards that will pop up right away. If you could fill that out, that would be awesome, because that really helps us figure out how to serve you better. And then in turn, you can support older adults more. So I did see a really great question. I'm going to see if I can find it here. So one of the questions that popped up from Lucky, I don't know, Lucky, if you're still on the call, and Beth, this would be a question for you. How did you get your employees to treat the customers the same as other customers? Some of our sites treat customers differently than regular paying customers. This seems to be a problem for participation.
And I talked about that there was this, oh, I don't want to use that. I don't need, I can afford my own meals kind of thing. And so for us, it's just natural when people come in and say, do you want the menu, or are you going to use your Iowa Cafe card? And we just are natural about it. And again, in our customer base, we have people who we know are economically are able to afford these meals, and the people who aren't see them eating and using their card, and it has no discrimination to it. We're just natural about it. The Iowa Cafe and the menus are together. You just bring them to the table. If they're going to use their Iowa Cafe card, you just scan it, and there's just really it's non-discriminatory. And I guess in our approach, and how we've always treated it. We've always treated it as if it's more of a congregation. It's more like trying to get people to come out and be together. It's not a free meal.
Yeah.
Yeah.
Okay. I really want to drive that home, because I think we saw some confusion early on. Some of the restaurant partners didn't really fully understand the contribution-based nature of these meals. And so, you ever play that game telephone? Sometimes the word changes, right? And so sometimes we did see them being described as a free meal. And, we know that sometimes people won't, as Beth said, like they're reluctant to accept services if they can't make a contribution. So really making sure to drive that home. If you can contribute something, that's a really important part of the program.
And I think in the beginning, in the beginning, I'm sorry to overtalk you, Bambi. In the beginning, I really stressed that this it's not charity, and if you feel like you can afford it, please pay for the meal when they ask for the money, because you're helping that person who can afford it, but yet now they can come out and socialize, and that's the whole idea, is to get people to come out and socialize.
Mhm. Yeah. I saw another comment about senior dining that they said it's fabulous and they use it for their restaurant voucher program as well. So for those of you who maybe don't use it or are looking for a program to use, senior dining is a good one to look at. Another question that I saw pop through earlier, and I can't find it specifically now, but Bambi, this may be a good one for you to answer, to talk about the home delivered meal programs in that area, and if it was competitive with this type of model, this type of partnership at all.
I think Janet probably actually has a lot closer knowledge, on
Okay.
how they were able to leverage that. But yes, I mean, bottom line is, that several AAAs leverage those restaurant partnerships to provide home delivered meals as well. I think we saw some really neat things happen in some communities where the restaurants got involved in recruiting the volunteers to deliver the meals, right, Janet? So I'll actually pass it over to Janet to talk about that.
Yeah, so this all got mushed together during COVID. There were noises about this Iowa Cafe thing happening prior to COVID, and we were all like, oh my God, this is gonna be so hard. We don't know how we're gonna do this. And then along came COVID and everything shut down. And I do remember one of our early restaurants, we said, if we can partner with you to do home delivered meals, because everybody wanted like frozen home delivered meals, and capacity was, it was bad for a little while. One of the very first restaurants that became an Iowa Cafe congregate site, she will sing the praises about this, because when our staff person walked in, she said she had $57 in her till and she didn't know how she was going to keep going for the rest of the month. She just didn't know. So we contracted with them for home delivered meals to start. We have kind of since pulled back on that home delivered meal model from our restaurants. And there's a combination of reasons, but it was really beneficial and it did a great job for us. We are the provider of home delivered meals in our area. So it's not any sort of a real competition. We do have people who receive both home delivered meals and have an Iowa Cafe card. It's not a lot, because if they're homebound and they're living, it's tough for them to get out, but I still kind of crack up when I hear that, oh, I used it once last month. My son drove 30 miles to take me, 4 blocks down to the restaurant. That is what we want, right? An opportunity. And she feels like she's so empowered to have her own way to pay. And that's great. So we do have some people who do use both in this particular circumstance.
Okay, perfect. Thank you. I'm going to answer one more question, because I've seen a lot of this, people asking if other states have programs like this. You can contact your area agency on aging for more information to see if they do. And I also put the link for our website for our innovative grantees in there as well. So, it's something that maybe if you want to be very innovative, you could start in your community as well. I'm going to go ahead and put the stop to questions. We have so many. And so what I'm going to do is take some of these questions and information in the chat and hopefully put some more information together. We will send out a thank you with a recording of the webinar. We'll have the webinar on our website as well, and we'll link those additional resources for all of you. Thank you so much again to our panelists, Beth, Janet, Bambi, for helping us with this. And just thank you for all of you for attending and listening in order to increase participation in your community as you continue to serve older adults. Thanks so much, everyone, and you'll hear from us soon.